Something that might get overlooked during the month of November is our dental care, but there are 2 big days observed during the month to help remind us the importance of staying on top of it.
Michael and I had a little conversation about flossing and brushing your teeth with Dr. Earhart.
Hello, Dr. Earhart.
Hello, how are you guys?
Welcome to the show today. So please tell us about National Brush Day. When is this observed?
Well, National Brush Day should be observed every day, but there's a national day for about everything, and then this one falls on November 1st.
Okay. So how many times should we be brushing our teeth?
Per day, we recommend brushing at least twice, morning and nighttime at a minimum.
I'm assuming that National Brush Day is celebrated November 1st because that's the day after Halloween, right?
I think that'd be best for a lot of the kids.
Absolutely. So obviously, with brushing, we also have a National Floss Day. Can you tell us when National Floss Day is observed?
Yeah, of course, and National Floss Day is observed on November 26th.
And so what should people know about these 2 days combined?
They go hand in hand. You shouldn't be doing one without the other. However, one is recommended twice a day. It doesn't really matter what time of day that you do floss. It's just that we have you floss at least once a day. And a lot of people might ask, well, when should I do this, before or after brushing my teeth? I typically recommend flossing before brushing your teeth. You could do some flossing afterwards as well to help get some of the fluoride in between the teeth where the bristles of your toothbrush just won't get. But if you can do just one, I'd recommend before brushing.
Okay. Dr. Earhart, let's talk some equipment here. So I like to use those little floss picks. You know, they have, it's a little piece of floss and it's on a little reacher hand and thing. But people
The little
tell
Star
me that
Wars
those,
thing.
Pardon?
The little Star Wars thing?
Yes, the little
thing.
Star Wars thing, yeah. But those, I've heard that those aren't as effective as regular putting the floss around your fingers and going it that way. Do you have any recommendations about that?
I think what most folks should find is that they should look for what is going to work best for them. Personally, myself, the little floss picks you've described don't work well for me. They tend to tear in between the contacts of my teeth. So I've had to look at a couple different flosses that I use manually with my fingers. And I've found that like the Glide wax floss works best for me. Nothing tears, it gets through the contacts well. So to each their own on that. They may have to explore a couple different flossing options in terms of what they can find in the store.
Okay, and what about toothbrush? How long can I keep around a toothbrush before it's time to kick it into the waste bin?
Sure. I'd recommend at a minimum replacing your toothbrush at least every 3 to 4 months. You could also keep an eye on the bristle of that brush. If the bristle is getting frayed and visibly worn out, it means it's time that you need to ditch that and you need a new toothbrush.
So staying on the subject of toothbrushes, what is better? You know, a mechanical, the electric ones, or just the regular ones that obviously are not electric?
Right, so you got a manual or an electric toothbrush. Both are great. I can't say one is necessarily better than the other. I think in the hands of the average individual, an electric toothbrush is probably going to do the most effective cleaning for them. With somebody with good dexterity and feels that they can properly brush their teeth with the manual toothbrush, they're going to be able to accomplish the same things that somebody would with an electric in their hand.
And just to kind of sum this all up, Dr. Earhart, if we are not brushing correctly, what are the downfalls? What's going to happen here eventually?
If we're not brushing correctly, we're going to end up with a lot of the common things that we see: cavities, gum disease, things that lead to periodontal disease. So we can really prevent a lot with incorporating these things into our daily habits.
Sure,
All right.
Brush your teeth, floss the teeth, because it's only going to, you know, benefit you and your oral hygiene. Thank you so much, Dr. Earhart, for being here.
There are 3 Prairie Rose Family Dentists in Bismarck, Mandan area. Call if you're in need of a visit with a dentist.